next about our partnership for the RSS Hub delivered by the University of Leicester and Partners. It's really lovely to see quite a few of our public contributors on the call, so thank you ever so much for making the time to come along, and I hope that you'll find this to be a particularly interesting session. And it's great to see a number of faces from the RSS PPI Leads group as well. So again, welcome and thank you for joining us. So today's session will be delivered by Jo Morling, who is Professor of Public Health and Epidemiology in the Lifespan and Population Health Division at the University of Nottingham, and Adele Horobin, Senior Patient and Public Involvement and Engagement Manager at the University of Nottingham, as well as public contributors Pam Rees, who's part of the NIHR FIRST team, Monica Tucker and Shanine Fasazi. And Shanine is the CEO and founder of Diversify Education and Communities, CIC. So the title of the team's presentation is Beyond the Usual Voices, Creative and Inclusive Methods in Public and Patient Involvement. So I think it's going to be a really interesting session highlighting the wide variety of work the team's been involved in. Just before I hand over to the team, just to say that this session is being recorded, and we'll make a recording available to the National PPI Leads group and to our intranet as well. And so if you don't want to be recorded, if you want to switch your camera off during just the main presentation, then feel free to, but perhaps when we come back to the Q&A, that aspect won't be recorded or won't be shared. If you could switch cameras back on, if you're able to, that would be lovely. So I will hand over to Jo and team to take it from here.
Thank you. So I'm going to attempt to put up some slides without losing you all, which is something I'm very good at doing. So I am giving the presentation today. It is very much a team approach, but I'll be quite honest, I wasn't organised enough to ask anyone else to help me actually write it. So I've got a dozen or so slides to share with you today, but hopefully with me, I've got Adele, who some of you may already know, who is our PPI lead at the University of Nottingham. Pam is a public contributor with the NIHR First Light team, and Monica and Shanine, if they're able to join us, are members of the public and from community interest companies who've helped very much with Grandma's House. And I also recognise some of the other public contributors on the call already today. It's clearly a small world. Cecily, Swati are also involved with First Light, so we'll recognise some of this. So is that shared?
It's shared, but not yet in slideshow.
Yep. Now we're in slideshow, and
That's
you're
looking
over there.
great.
Fabulous, great. So Becky approached me after reading some work that we'd done and said, would I like to present on that? And I ummed and ahed about what was the best thing to present about. So what I've chosen to do is talk about a selection of bits and bobs that we've been doing in PPI land. And, you know, I don't lead all of these, but I have been involved in all of these, and I'll make sure you know who to contact for what as we go through. But we come in from this very much with a lens of reaching that stage of equity, of making things fair, and thinking about this concept. If we want to make our research as inclusive as possible, in order to do that, we need to get our public involvement right. And often in order to get our public involvement right, we need to get our public engagement right before that. That coming in cold and expecting strong and appropriate public involvement is quite ableist of us, and that there's perhaps a stage before that. But at the same time, I'm not saying we've got it right. What I'm saying is we're trying some new things, we're trying some different things. And one of the key things we're trying to do is we're trying to evaluate this as we go along so that we can show what it is achieving and what it isn't achieving, if anything. So that's the lens we're coming from. I've got 4 things that we're going to share with you today. So I'm going to talk to you a little bit about creative approaches to public involvement and community engagement, a little bit about a project we did called Who's Behind the Door, a little bit about a project we've done called Grandma's House, and a little bit about some evaluation work we've done about the actual benefits to contributors and what they've taken away from it. And all of this together, as these bits and bobs have grown, we've kind of begun to pull them together under a research group that we've called Bridge, because it's not just doing public involvement here. This is about also trying to understand what works and why and when. So what are the strengths and limitations to utilising creative methods? So this was done within the auspices of First Light, an NIHR initiative. And we wanted to, before we could even decide which ones were the right ones to use, what methods we might want to try, we thought we'd better understand what was good and bad about using them and whether there were any particular barriers to doing this, and how people had done it in the past to see what we could learn from other people. So we undertook a systematic review, which has since been published. We used the JBI approach, and in summary, we managed to find 12 papers that met our inclusion criteria, and they used a huge amount of methods. So songs, poems, drawings, photography, all sorts of different bits and bobs. And I would say the biggest challenge to doing this review was, what is a creative method? And how do you search for it? And that was very difficult. So we went for them being the types of things you can see here. But in terms of also when we came to publishing this, one of the other challenges we faced was we got a lot of pushback from reviewers who felt that even a focus group was a creative space. It was a storytelling space. It was a creative opportunity. And that therefore we perhaps actually shouldn't be separating creative methods out into anything in their own right as a separate entity, and we shouldn't perhaps be thinking of them separately, which is an interesting viewpoint to take. But in doing this work, we came across 9 themes, 4 of which were limitations and 5 of which were strengths. And the key things that came out of this that made these really beneficial was this real sense of disruption of power hierarchies, that often when we have discussion groups with members of the public, more traditional approaches, they may be led by an academic, they may be led by a more established member of the public, and that often being able to remove that power hierarchy and at times taking the academic out of the picture altogether was felt to be very, very beneficial, and that people who perhaps hadn't spoken up before were able to. They felt it provided an opportunity for the unsayable to be said, that things that might be a bit more taboo or stigmatizing or all sorts of bits and bobs. They felt they were much more inclusive, that people who perhaps had learning difficulties or language barriers or physical barriers or all sorts of barriers found that some of these different methodologies made it much more accessible to them. They found them more engaging and interesting. There was a general sense that being invited to focus groups could get a bit dull, or just different places to talk, and that actually doing something that had a bit of fun to it was just a nicer way to spend an hour or two. And it's a slightly controversial one because it comes up as a limitation as well, but it was felt overall from the evidence that they're quite cost and time efficient. But equally, that was a bit of a limitation, in that actually some of these approaches can be very time and cost intensive. There were concerns about that access to resource, and in particular for doing preparatory work, and in particular for building up those engagement and strong relationships to begin with. Some people felt there were some growing ethical issues that probably went beyond creative methods, but in particular with creative methods, that because they often got more depth, they felt that maybe this was actually beginning to border into research at times, but also with that kind of safety netting, that if people were disclosing difficult things and emotive topics, how are we keeping them safe? The biggest limitation, which came under the overarching bracket, though, of external factors, was researchers. Was seeing that research didn't necessarily see these methods as useful, as real, as proper. They didn't know how to do them or use them, and just getting that buy-in was quite a challenge. So that was the first thing I was going to tell you a bit about, and I think it'd be quite nice if we just discuss it all at the end in a one-er, but I'm open to questions as we go along. Do just shout if you need to. I don't know if the video will work, but our contributors did actually make a video for us summarizing this information. So you'll have to tell me if I've got the right settings for sound or not. Can you hear that?
No.
No, right, pause. There is a little thing. Can anyone remind me what I have to do?
It says you share it as you share your window normally.
Yes, that's where it is. You are right. Thank you, person who said that. So I will stop sharing and then I will share again and include sound. Thank you. Cool. I'll just pop it back up. Is that sharing?
It's sharing the
Is it-
slide.
Yeah, that's fine. I was just checking. I hadn't got one of them red
Public
boxes.
and
Can you
patient
hear it now?
involvement, or
Yeah.
PPI, is crucial in research.
A bit quiet.
It ensures that the needs and wants of patients are at the heart of the research process.
Seems to have stopped.
Yes. I tried to turn the volume up.
Traditional methods like interviews and group discussions can exclude people with communication difficulties or disabilities. Whereas creative PPI approaches, like using art or animation, can engage patients and the public in new ways. Our research examined the benefits and drawbacks of these creative PPI methods in health and social care research. After reviewing 12 studies, we found that these approaches can promote equality, provide a safe space for expression, and be cost-effective. For example, one study used songs and poems to engage adults with language or memory impairments. Another project utilized social media to connect with young people and gather their input on research. Of course, there are also limitations to consider, such as time, cost, and resistance from the research community. But overall, our findings show that creative PPI is a valuable approach with the right method depending on the project and people in the group.
So yeah, so that's just a wee short summary of what we found made by some of our public contributors. So I'm going to move on from that and talk about a different project we set about, which was called Who's Behind the Door, and this was funded by what was the RDS at the time from their Enhanced Public Involvement Fund. And being a public health person, I don't have a specific interest in a specific disease per se. What I'm interested in is prevention. I'm interested in population health, and I'm interested in communities. So we were quite keen that we tried to access some diverse populations to get their voices, to hear their needs, but that weren't ring-fenced by a disease. So we worked with some social housing tenants with a view to trying to understand a bit more about what the health and research needs of social housing tenants in Nottingham might be. And I'll come on to why we focused on social housing tenants in a moment. And we did this through a number of online and in-person group meetings. And Olivia Phillips, Liv, she led a lot of this, one of our research assistants. And she did a lot of groups, and they looked at research needs. They did some prioritization exercises. And some of the key things we found here was there was a huge variety of mobility and technological ability. So some of these groups are in person because some of these people aren't digitally active. We've got one member we correspond with by post. They had very little understanding of the research process and health service decision making. So again, there was quite a lot of educating to a degree up front to make it so that they were able to engage in the conversations we were hoping that we could have. But at the same time, we were very conscious of the fact there's lots of me in this. This is like, I'm saying they needed to be educated in order to have the conversations that we wanted to have. And so we were very mindful we were making this very about us, not intentionally, but that on reflection, what was their role in this? What were they getting from it other than being told that we'd try and make things better for them, And what was quite interesting was when we pulled off all the NIHR public health research themes of the open calls at the time and asked them to prioritize them with some alignment with some of their own priorities, they really weren't interested in most of the NIHR ones. Sorry, I'm just flicking my screen around slightly. So why did we think about going to speak to people in social housing? Well, we know that there's certain groups of the population that are underrepresented in both research and public involvement in research. And we know that social housing represents some of the most deprived households in our locality. So 20% of the households on the lowest income spend more than a third of their income on housing costs, compared to only 3% in the top quintile. You know, that 10% of social renters versus owner occupiers. There's a lot more spending on their housing needs. So it's a massive outlay for them that they don't have available for other things. It's a lot of people. It's a lot of people in social housing in England. And again, they represent some of those groups of people who have been continually underrepresented in some of the work that we do. So whereas 16% of white British households rent social housing, 44% of some of these other groups are in social housing. So we know it's a group of people that aren't typically spoken to for this. So what did we do? And we partnered with Nottingham City Homes, that's now been consumed into Nottingham City Council. And we did partner with a couple of other housing associations, but it was Nottingham City Homes where we built up the best relationship. And as I say, we held a series of discussion groups and sessions talking about all sorts of things. So we didn't go in with we went in with the aim, and we did share with them the aim that we wanted to understand their priorities. But what we didn't do is say to them, tell us your priorities. What we wanted them to do was to tell us their stories of what life was like for them, how their days were. We asked them to talk us through what it was like to go and see the doctor. And from that, we made notes and identified the things that were recurring themes that were coming up and again. We managed to get a moderately diverse in terms of ethnicity. You know, it's not representative of social housing per se, but was majority white. We had 32 people in the end joined us. We were majority female and heterosexual, but the majority did identify as disabled. So there was a reasonable variety in there. And the group were fabulous at engaging and discussing and really making it their group. So firstly, they didn't want to be a public advisory group or a patient advisory group. They renamed themselves a social advisory group, a SAG. They came up with their own sort of logo with the different people about listening, understanding and speaking, and delivering with, that says NCC for Nottingham's, NCH for Nottingham City Homes. We created posters to present, and again, rather than having it being the very traditional academic poster, as you can see, it's not. And we took that opportunity to try and work out what were their biggest priorities. So the things they ranked as being the biggest priorities for both healthcare and research, it was often quite hard to disengage the two entities, was really to do with access to healthcare services, was by far their top need. And we didn't at this stage get into the depth of any particular services. It might not surprise you to know that their other top thing was about the poor quality of their housing and the impact they felt that had on their health. And then mental health issues. The little things with stars are the ones that we took from the at the time, the open funding calls from the NIHR. So some of them did get ranked quite highly, but not all of them. And there were loads more that didn't make it into the final ranking. We had about 50 different cards to start with. And since then, we've been going back to the group to discuss specific research proposals, to discuss what might be a research proposal in all sorts of different fields, but largely around healthcare service delivery and provision of healthcare. So that is what we've done there. So I'm just wondering, has Monica and or Shanine been able to join us at all before I go on to Grandma's house?
I don't think so. I've been checking an eye on the list of participants.
No worries, not at all.
No.
So I was introduced to...
Excuse me, can I just ask, can you clarify? When you're talking about this, are you talking about council tenants, or are you got housing associations and private landlords mixed in with it?
So it's people who are in social housing. So some of them will have been in private rented via the council through social housing benefits. So often the councils now take on private houses and use them in the form of social housing, but they are not traditional private renters. So I'm just going to play the first bit of this little video from Jar Digger, who is a poet.
Feel Alex
Oh
is
yeah,
good
we've
as
got to
it
have an
looks.
advert first,
Tender
sorry.
pieces in jelly.
Feed your cat like a star.
Grandma's place. All of your uncles and aunties under one roof is the reason why there was a smile on Grandma's face. The aroma of soul food created a whole new sense in my nasal. The reason the question is food ready being answered like patience. Grandma's place is foundation, it's where it started. The old school furniture, the vintage carpet, the fridge magnets on the fridge show that the yard was owned by yardies. The beatings that Cuz got for putting his hands in the Dutch pot were legendary. Cause all you heard is I want the blood clot, but off back came secondary. I miss Grandma's place. She passed away. And when she died, things changed, cause some of the fam don't even chat today. So I'm like, come mum, if I make 2K, I'll be like, here's a grandma, like I'm bringing back my...
So I'm going to pause it there. You could go watch it at your leisure, but because there's 4 minutes and we need to keep going. But this was a reflection on past times in the African Caribbean community and about how grandma was the matriarchal heart and soul of the family. And this was an approach that was brought to us. This is entirely community generated by Monica, who hasn't joined us today, but may do yet. And it was her idea, and she took it to Adele, who's led on this project, and I've been there very much in a sort of supporting role, about how there'd been a sense of loss of some of these concepts and identities for some of the African Caribbean communities in Nottingham, and how that loss had led to a loss of dialogue across generations, and that it was an ideal way, they felt, to generate new conversations, new learning and new interactions, and that it didn't have to be kept exclusively within the African Caribbean population, but it was something that they felt a kinship for. It was something, as I say, they came to us with, and that it was something that they felt they owned, they led, and they controlled. And it was quite a different project. And still, I don't want to go watch it all, thank you. And it still is an ongoing project. So it was initially funded through some University of Nottingham People, Culture and Environment funding, some internal funding, and we've since been funded through the NIHR School for Primary Care Research to continue it. And this is a genuine attempt at handing over control, which is interesting, challenging, fun, scary. I could probably keep going with lots of different words, but incredibly rewarding. And one of the things that was repeatedly said to us was public involvement can often still be all about the researcher. They know that we're often doing things with the best of intentions, but we had an opportunity to maybe support some community research champions, for example, and it was suggested that money could be given to community organisations for them to work out the best way to spend it to develop community champions. And again, members of the public came back to us and said, no, you're asking us to solve your problems. What's in this for us? Why should we solve your research problems? You created this systemic isms that has led to us being excluded from health and care and research. You need to fix it. You need to make sure there's something in it for us. And we need to work out how to do this. And they weren't quite as blunt as you need to fix it. They were open to working on it together, but very much a matter of, yeah, we're not here to do your job for you. So tell us what's in it for us and we'll see what we can do. So they came up with Grandma's House, which is all about celebrating the wisdom, status and cultural knowledge of grandmas. And, as I say, all credit here to Monica and Adele. And in fact, the next 2 slides, Adele will totally recognise as the poster she made that I've just turned into 2 slides. And it would allow us to bring together generations for shared learning. It would allow us to forge strong relationships. And the concept is that in days gone by, young people would visit their elders to learn. And some of this came about because frequently, as part of Windrush, but for other reasons as well, parents had to go out to work. They had to go a long way to work. So often grandma would be the person that cared for the children, did the schooling, taught them how to cook, so many of those domestic skills and tasks. And that was something that they all still held on to, as we've heard from Jar Digger. So they suggested we might want to recreate that, because they wanted to recreate that for themselves, to help them and their communities, so that we could help them celebrate their tradition, but that we could learn with and from them. So we partnered with the Beechdale Community Centre, the Essential Baby Company CIC, which is Gemma Poole, and Diversify Education and Community CIC, which again is led by Shanine, who are all fabulous ladies who have so much for us to learn from them and have so much to give, which is just so wonderful. And they've really done this, and sometimes I've said at some of these events, I'm just the money. Sometimes I just turn up and pay the bill. It's not quite as straightforward as that, and Adele does an extremely large amount of organising for it. But in terms of what we do, they do it, and we have to just trust them. So what have they done? Well, we've commemorated Stephen Lawrence Day on Stephen Lawrence Day by taking elders to Fernwood School to discuss with Year 10 pupils that sense of belonging and growing up in the Caribbean and England, sorry. And there's pictures here of the team of us. Mrs. May, she's like 92, and the feedback from both the adults and the children has been phenomenal. And when you might be thinking, well, what's this got to do with helping research? There's kind of two things here. So firstly, we need to give and build those trusting relationships before we can even begin to have those conversations about research. But equally, in all of these things, there's been health-related discussions and things brought up without us saying, we've come to you today to talk about X, Y, and Z. So there was talk about mental health from the children. There was talk about bullying, stigma, lots of these kind of things. There was talk about families, connectedness, all sorts. So the second event we supported tied in with International Children's Day. And we went to the Pilgrim Church in the Meadows. And this is Clive, who's the senior pastor there and is now the I've forgotten his exact title, Adele, the Windrush
Commissioner.
Yeah. And we went to church, so we went to their church and we discussed the role of food, heritage, family, and they supplied, and we paid for, loads of Afro-Caribbean food. And again, we had the opportunity to discuss the role of food in heritage and how different foods, those health aspects of food, because again, they were very acknowledging that not all of their foods were the healthiest by nature. What did it mean? But that again, those conversations that you might have with your doctor, they didn't know what the food was they ate, and when tackling things like obesity, that we perhaps needed to have some different thinking about some of those conversations. The third event was a Windrush celebration. And there's a book called Small Island by Angela Levy, which is Windrush related. And again, with no prompting from us, they'd contacted the author and got permission to put on a play related to that. And into that, they interwove aspects of health, and in particular, based on their ideas, skin and dermatology. So again, we supported this by bringing some dermatologists, and there was discussion about traditional remedies, skin health, and again, a lot of discussion about the challenges of accessing health services when you perhaps see things or use things that are a little bit different. The fourth event was the Dads and Lads retreat, where some dads and lads go on a retreat, and we funded some additional elders to go with them. This was a truly multi-generational event where they spent a weekend away, and neither myself or Adele went to this. This was we trust you to have these conversations, and they had sessions discussing health, university, how are these things connected, what does it mean, and some of that preliminary, what you might consider the educational bit that perhaps people need to have before they can have some of these discussions, but again, without it being this is an educational event. And again, the feedback has been really very, very positive. And we're now in a position where we can continue having these conversations. We can use is the wrong word. some of these elders and some of these new links we've got will have some of these conversations for us. So I don't need to go and have a chat with them about my research. They'll do it all for me, and they'll do it in a way that works for them, with outcomes that works for them, at a time and place that works for them. And I just have to trust them, and trust what they bring back. So we've got all sorts of bits and bobs lined up, with expanding into Grandad's Shed to go with Grandma's House. There's no specific cultural reference of Grandad's Shed, but again, it was felt that whilst Grandma's House isn't exclusive to women or being a grandma, that perhaps men did need a separate safe space where they could have these conversations, and that by being with them from the beginning, this was the key thing, that often we may, through some of our public involvement, join some existing groups and say, well, would your mother and toddler group like to talk to us? And there's nothing wrong with that. But what they were saying is, why don't we start something new from the beginning with all of us, so that we're all in it together from the beginning, so that it's not you joining us or us joining you, it's ours. And so that's what we've been doing. There's talk of a pantomime. There's all sorts of bits and bobs on the cards. I think the other thing we've done with this that we've been quite proud of is introducing more people to public involvement and ways of doing it. So Monica's in the lobby, in that we had both a intern and a medical student volunteer who've worked with us on this, so that people are getting introduced to this idea of public engagement and community involvement much earlier in their careers, and it's becoming a kind of normal thing to do. So again, I'm not saying this is the only way, I'm not saying this is a great way, but it's certainly been a good, fun, interesting, and seems to be going quite well way. But there's still time will still tell, and we're working on evaluating this as we go along. So the final thing I wanted to talk about, and then we'll have some open discussion and we can talk with some of our public members, is just beginning to think about, it's all very well, as I say, coming up with all these novel ideas, but does it work? And what does it work look like? So some aspects of does it work is, has it impacted the research? Has it impacted anything else? And so we are evaluating all of that within NIHR First Light, our public contributions in this, which is a public health team that do evaluations of local authority research intervention. And for this section that I'm going to show you now is, we aim to determine the benefits or disbenefits experienced by the public contributors in First Light, and any associated enabling factors that allowed those benefits or disbenefits to be realised. And for the purposes of this, we defined a benefit or disbenefit as something they kind of took away from the session. So it could be something they experienced in the session, but really that benefit was something that was slightly longer lasting to them. And just so you can understand our approach, because this is, we were wanting to work out if this approach helped create any benefits for public. We have a public co-applicant, which is Pam, who's here today, and she's 1 day a week with us, employed through the university to provide public contributor support. We have an oversight board that meets twice a year, which is very much independent, with 2 more public contributors on it. We have the next tier down, which is our public advisory group, which has about 8 experienced public contributors on it. And then for each of the little projects we do, of which is about 10 all around the country, they're not local at all, we have 1 or 2 of our PAG join those local project evaluation teams, so that we can get project level PAG that is very much locally established for the project that we're needing, but there's the peer support of more experienced public contributors, because a lot of these projects are very public involvement naive, and it's not something they've done before. So we conducted a number of interviews. We got formal ethical approval to evaluate this, so we've interviewed people at all levels of PAGness to try and work out what the benefits they took away from. And our initial results, which we're just writing up, we've got a small working group, are that of the benefits and disbenefits, they could be largely thought of as mainly around well-being. So that was, people got a real sense of personal satisfaction. They got that warm, fuzzy feeling inside from being a public contributor on our projects. And that came with empowerment. And there was a slight element there in that well-being. That was about the only disbenefit, was that there was sometimes some discomfort, that sometimes things didn't go as planned, that there were disconnects in expectations, it wasn't always possible to do what we'd like to do, or it just went wrong. You know, we as researchers didn't do what we said we'd do. The other benefit they took was a sense of community, that they formed friendships, they expanded their thinking with other public contributors. There was a sense of taking away some skills and knowledge, but that wasn't a major theme, and certainly not this concept. Yes, they did take away new knowledge of research and public involvement methods. There was some stuff about how things need to be different in public health to perhaps more clinical specialties. But one of the things that came through very strongly that they took away was a real understanding of local authority structure and how their local government works, and about all these other community assets that were potentially available to themselves and other members of the public. That they had no idea how many different community sort of CICs, charities, health service, local authority funded initiatives, all these providers that they could potentially access were out there. There was no doubt it was a benefit to get paid to do PPI, and that was a benefit. And the other benefit really was that, particularly growing from this bit, was they felt they were able to share those benefits with other people. And that kind of ripple effect of having been involved with us was that they were able to share their newfound knowledge of different community initiatives with other people. And what was it they felt that we did that enabled this to happen? And this sat around being heard and respected, and about logistics, that in general, we were quite well organised. We were quite good at keeping in touch. We paced it in a pace that worked well for them, and that we kept them very much as part of the team. I mean, I'm saying all this knowing that 3 of my public contributors are in the audience today, so they may say something different in a minute. But that is what the research demonstrated, and we got an independent person to conduct the interviews. So that was just a whistle-stop tour of 4 of the things we've been doing. We've been doing lots of other things, but they were the 4 that I felt were probably of most interest, were perhaps things you hadn't heard about before. And so I'll stop there. What I do have, and I'm happy to share the slides, is a few thank yous. So obviously Adele and Liv, who were at the university and did a lot of this. This is Gemma from the Essential Baby Company. Shanine, who will hopefully join us. Pam. This is Denise, who's a social housing tenant, who was one of the driving forces of keeping our social housing group going. And this is Monica. And should you wish to read any of these things, find out more about them, you can click, scan, whatever, and you'll find them all. So I am going to stop there when I've found the stop sharing button, which is over here. And really just, you know, invite any questions, invite Monica, Pam, Adele, Cecily, Swati, any members of the public who've been involved with any of them to tell them all the things I didn't tell them, correct all the things I got wrong, and generally be your normal awesome selves.
Thank you, Jo. And yes, Monica arrived, I think, halfway through the Grandma's House discussion. So thank you very much for coming, Monica. I think she's there.
Yeah, I think definitely Monica and anyone else here can talk about these initiatives way better than I can.
And do you want me to tell you a little bit about Grandma's House then?
Yeah, that would be great. Yeah, thank you.
Yeah, well, Grandma's House started with me working with Adele for the last three years, and we were trying to find a way how to connect the public with research. And we put our heads together and we couldn't think of anything until one day a light bulb switched on in my head and said, why not do a Grandma's House? And Grandma's House is the intergenerational conversations, and we can have it around research. We've done one around skincare. We're doing one with dementia, and it can be linked to lots of different types of research, and I think it works quite well, because I get people ringing me up, not on a daily basis, but you know, every now and then saying, oh, I want to get involved in this research that you're doing because it sounds good. want to be involved in Grandma's House. So it's a way of, like I said, connecting with the researchers, and the researchers connecting with the community. And like I said, I think it's working very well. So fingers
I think it's
crossed.
absolutely brilliant, and the fact it's going through the grapevine just shows that people are very interested in how successful it's been, I think, Monica.
Yeah.
Yeah, and I think Monica is potentially slightly underplaying as well how much of a linchpin she is for all of
Yes,
this.
definitely.
But there's a number of schools that have reached out and said, "Well, come Grandma's House, come and visit us," and things like that.
Yeah.
So and largely it's Monica and the other community members that field those inquiries and manage it all.
Yeah.
Thank you.